Hello, I am Dr. Veerendra Koujalagi. I am medical gastroenterologist practicing in Sahakar Nagar, Bengaluru at my clinic Eka Gastro and Liver Care. Non-alcoholic fatty liver disease. So, non-alcoholic fatty liver disease is a very common illness that we find in our regular practice. It is very much common now because of the sedentary lifestyle that we all experience, and also India being the capital of diabetes of the world. It is almost every other patient with diabetes mellitus ends up having non-alcoholic fatty liver disease. So, when do we call this non-alcoholic fatty liver disease? Nowadays, the term has been changed to metabolic associated liver disease. So, when initially the fatty liver was much commonly seen in patients who take alcohol, and in those patients who do not take alcohol and tend to have fat in the liver were termed as non-alcoholic fatty liver disease. But because of the rampant change in the lifestyle, now we commonly see this amount of fat deposition in non-alcoholics predominantly. Hence, it has been changed to metabolic associated liver disease. So, this happens because of sedentary lifestyle, because of impaired glucose metabolism, and in patients with diabetes. It can happen in patients with lean structure also. So, those who are not obese also, but is very less often. Because of impaired metabolism of the lipids, such people may have tendency to form fatty liver disease in spite of their lean structure, or sometimes they may be skinny fat, that is they may have less muscle, more fat, and most of it could be central. So, central obesity, that is obesity around your tummy and chest area, and lean limbs are also one of the leading cause of this non-alcoholic fatty liver disease. So, how do we treat it? The most important aspect of treatment of non-alcoholic fatty liver disease is lifestyle change. So, what is the lifestyle change that we expect is to cut down on intake of sugar. Sugar is easily digestible carbohydrates like the sodas, the Coca-Colas, Pepsis that we regularly enjoy. So, all of them contribute to increased sugar intake, which makes the liver to metabolize the sugar into fat and deposit in itself, causing the fatty liver disease. So, what could be our diet and exercise pattern? So, daily 45 minutes to 1 hour of exercise which is rigorous and covering more than 8,000 steps per day, and as well as having more amount of complex carbohydrates and protein in the diet and less amount of simple easily digestible carbohydrates will help in reversing this fatty liver disease. And of course, nowadays there are a lot of medications that are available which can help in reversing the fatty liver disease and as well as controlling the weight. But there is no parallel to changes in the lifestyle, as these lifestyle changes are for lifetime. All the medications that we give act as long as we give the medication. So, it is important, and it is easily diagnosable now, especially with usage of ultrasonography. Although it is not specific, it can be helped to screen, especially patients who are obese, patients who have diabetes need to get screened for this. And if there is fatty liver, then we have to go and assess some biochemical parameters and tests like fibroscan, which helps us to determine the presence of non-alcoholic fatty liver disease.